What's up, everybody, and welcome to this week's episode of the Well Man's Podcast. My name is Brian Brosey. I'm joined by my friend and co-host, Keoni Tita. Keoni, how are you today?
Good. Hey, everybody. Thanks for listening to us on this podcast. Once again, I hope we're putting out great content for you. Please give us some, ideas or stuff that you want to hear from us, how we can do it better. I mean, Brian and I, we're just flying by the seat of our pants with a lot of this. We have a lot of information that we want to put out there, and we want to keep you guys listening. So we want to put out some good content. So let us know how we can improve it.
I'll interject here, Keoni, and just say we do have the link for the salad giveaway in the bio of this episode. So if you click on this episode where you can read all the information, you can click that link. That link will take you to a page where you can fill out basically some of the information Keoni just asked for. All we ask is your name, your email, and then we ask I think 2, maybe 3 questions, and it's really just information for us. How can we make the show better? What topics are you interested in? And then how do you consume the show? Are you watching it on YouTube? Do you listen on Apple Podcasts, Spotify, or how can we just better serve you? And that's all we're looking for. And then after that, you open up it automatically opens up to another page where the salad PDF is there, and then you get emailed the salad PDF as well. And that gives you, I can't remember what episode it is. It's like 1923, early on.
Yeah, it was one of the early ones.
We did the ME salad, and that gives you the PDF that we're referring to, gives you all the goodies about that, how to make it, how to store it, all the details, so you don't have to take your own notes from the podcast. You've got it all right there ready and presented for you. And we just asked for a little bit of basically how can we improve the show for you.
Great. Yeah. So today's show, you're definitely the expertise on this, Brian. So I'm thinking I'm going to learn quite a bit, as our listeners will too. Hopefully I can add something to it. But this is on lower cross syndrome, which I don't know too much about.
Yeah, so these syndromes, we've talked about lower cross and upper cross syndrome in various podcasts, like when we did the sitting podcast. I know we talked about upper cross syndrome a little bit. And what they are, they're not really diagnoses. I first learned about these and if you're hearing some of that Florida weather, I'm sorry, we're getting a thunderstorm right now. But these syndromes are not diagnoses. They're basically a cluster of things that I first learned about when becoming a personal trainer. So anyone with some sort of health and fitness background should at least have some sort of knowledge of these. And they really just help us understand these patterns of strength and patterns of weakness that are really common in society today. And particularly, like you mentioned, Keoni, we're going to talk about lower cross syndrome today, which is also known as pelvic cross syndrome. So with these syndromes, we see a specific pattern of muscle weakness and muscle tightness. Now, I want to throw in a physical therapy caveat here and just mention that tightness and weakness, they can go hand in hand, where a tight muscle can also be weak, whereas a overly lengthened muscle can also be weak. So when we first learned about these as a personal trainer, we learned kind of tight is the opposite of weak. And that's just not necessarily true. We know when we look at the physiological components of muscles, they kind of cross each other almost like Velcro. And that's how they gain that tension. And if we're, if you can imagine, if you shortened the Velcro so much that it didn't have as much area to kind of grab on and reach out and connect with that other piece, it wouldn't be as effective. Same thing for if the Velcro pieces were too far away. It's just, there's an optimal length tension relationship for our muscles. And that's all I'm trying to say about that. But in this context of the podcast, we are going to talk about weak and we are going to talk about tight. Weak being obviously a weak muscle, whereas tight being a muscle that necessarily isn't reaching its full range of motion. So when we say like the tight hip flexors, it may limit your gait, your walking, by not letting you reach that full hip extension. And so you could see this in people who have a lot of anterior pelvic tilt. You see this a lot, not necessarily so much now, but like in like sprinters or high level athletes back in the day, like kind of like a lower level, like high school or just starting out in college before they've really gotten into a strength program with an expert, where they just have these crazily dumped forward hips. Like you're looking at their ASIS, there's 2 hip bones and they're like pointed forward like a bowl pouring out all the milk.
Yeah.
And that's one of these telltale signs that kind of helps cue us into lower cross syndrome. But so these cross syndromes, they are exactly what they say they are. They're a crossed specific pattern of muscle weakness and muscle tightness. So when we're talking about lower cross syndrome, also known as pelvic cross syndrome, we're focused on the pelvis. So those weak muscles, that straight line, because again, we're making an X of weak muscles, and then the other line that would complete the X would be the tight muscles. So those weak muscles, that first line is going to be your abdominals, so the front, and then the weak glutes, so in the back. So you can kind of envision that line going from your belly all the way to your bottom, and that's that line of weakness that we see in lower cross syndrome. So what muscles would that be? That'd be the rectus abdominis, the obliques, internal and external, the transverse abdominis, and then the glute muscles, glute max, glute med, glute minimus. And when we get the shortened or weak aspect, these muscles are inhibited, and we basically have to loosen the other portion of the cross to help strengthen them and get them back to fully functioning, efficient, optimal length. And we talked about, I know in a few podcasts, we've talked a lot about like training your core and how to do that correctly. That'd be a great time to go refresh on that, because all those muscles I just mentioned, the rectus abdominis, those internal and external obliques, the transverse abdominis, the TA, all need to be trained appropriately. And we really discussed that in that episode. I think it's like in the 50s, but it's how to train your core intelligently, I believe. Then we've also done some back stabilizing ones where this would also come into play, specifically that TA. So that's that line of weakness. As far as tight goes, these are the hip flexors, the thoracolumbar muscles. So basically when you feel down your lower back and you kind of feel those two muscular, like bulbous rods going along your spine in the very bottom, and that fascia that connects there, so basically your lower back area and the muscles there, those will become tight. And this results, so you've got tight hip flexors and those tight thoracolumbar extensors and the fascia there. And this really gives you that increased hip flexion, increased lordosis look, that anterior pelvic tilt that I was talking about with some of those athletes as an example.
Okay, so it's almost like those muscles in your low back are all crunched up and tight, which pulls the back of the pelvis or the bowl up, and then the front of the pelvis, right, kind of dips down.
Yep, and it could be pulled down even by some of those hip flexors.
By the tight hip flexors, yeah.
Yeah, exactly.
So think of your pelvis as a bowl that has been tilted anteriorly.
Yep.
So that's why a lot of times for me, when we have low back pain, a lot of low back pain is due to this, correct?
100%.
Yes. So a lot of times, sometimes just stretching your hip flexors can relieve some of that.
Right. And we're definitely going to talk about how to do that and how to do that real efficiently in this episode. But just to piggyback off what you're saying, Keoni, this anterior pelvic tilt or this lower cross syndrome, again, anterior pelvic tilt would be kind of how it presents and what we would kind of say the person's pelvis looks like. This syndrome can really increase the incidence of joint dysfunctions. That would be anywhere in your lumbar spine, your sacroiliac, your hip, and anywhere else in the body. Just imagining that we are focusing on the fact that we're having some improper distribution of the forces here. When we create this anterior pelvic tilt, we're changing our ground reaction force, the way that the Earth's force when we walk interacts with us. And we're changing that to be not perfectly congruent with our joint surfaces, which helps distribute the load nice and safely and efficiently. It can increase low back pain, absolutely. And it can increase other curves, natural curves of the spine, because we're compensating for this posture. Yeah. So it's something that definitely needs to be addressed. And the earlier you address it, the better off you are, 100%. But just to name those muscles that could be tight. So the back here, we're talking the erector spinae, our multifidus muscle, one of my favorites, the quadratus lumborum, and the lats can even become tight. And that's really with the fascia there, kind of connecting all these together, that can become tight. And we're talking about the hip flexors, the iliopsoas, the tensor fascia latae. These are all muscles right there, kind of where your pockets are for this episode. So if you feel, put your hands in your pockets, and right there is really where your hip flexors are. Put your hand right on the small of your back, and that's where these tight thoracolumbar fascia and thoracolumbar muscles, specifically the lumbar ones, would be. So again, just to reiterate, the weak is the abdominals as well as the glutes. So then we've got that straight line going from the abdominals to the glutes, and then the tight portion of this X is the thoracolumbar fascia extensors, the stuff behind us, above our pelvis. And then the other tight portion would be our hip flexors. So more so on the bottom portion of the front of our pelvis. So how are we going to treat this? Obviously, if it's tight, we're going to stretch it, and then we're going to strengthen the weak muscles. And we've done a few podcasts talking about how to target some of these specific muscles. But the whole point of me kind of talking about that length tension relationship at the very beginning is that the most important thing is to ensure we get all sides of this X at the optimal length on both muscles. So the tight ones need to be loosened. The weak ones, they may need to be shorten but become stronger and just reach that optimal tension, optimal length, so they can create optimal tension. And talking about how to stretch, this is really important, and I use this all the time. So there's this concept of reciprocal inhibition. And what that means, Keoni, is that you basically, if you picture a bone and you picture muscles on either sides of the bone, you can't have both sides pulling on the same bone. So one side has to turn off. So let's use our, we'll just use our ab or our bicep as an example. That'll be great. So if we're using our humerus as an example, if we want to bend our arm and kind of make a bicep muscle, make a flexed arm, we have to relax our triceps or else we'd get nowhere. So that's reciprocal inhibition. It means basically the one muscle on one side of the joint relaxes to accommodate the contraction on the other side of that joint. So to use that to address this situation, let's say we're stretching our hip flexors. We're going to squeeze our bottom the entire time to get that reciprocal inhibition of our hip flexors for them to relax by contracting our glutes. So you're using the opposite sided muscle to really reach a deeper level of stretch without really, I'm sure you've seen people in the gym, Keoni, do that hip flexor stretch where they're leaning in, look like a half crescent moon and all that kind of stuff.
Right.
Not necessarily necessary. If you can really use that reciprocal inhibition, I was teaching a kettlebell class today, and as soon as you squeeze your glutes, you immediately start to feel that stretch in your hip flexors, especially most Americans today with all the sitting that we're doing. Yeah. So if you put your leg up on a bench and just take like a lunged position and then squeeze your bottom and sink into that a little bit, you should really feel that hip flexor stretch. And that's a way we can use reciprocal inhibition to more effectively stretch. That was the key point I wanted to get across for how we're going to stretch these things.
That's great.
So again, hip flexors you're stretching, thoracolumbar extensors you're going to stretch. Those you can stretch with things like child's pose, like a child's pose walkout, walking your hand to the left and to the right, and just getting a nice deep stretch there. So again, if your thoracolumbar extensors are kind of pulling you into extension, anything that's going to increase that spinal flexion. So laying on your back, bringing your knees towards your chest, just creating a rounded spine like a C. That's going to be beneficial. Again, using that reciprocal inhibition, that's going to be your best friend for that hip flexor stretch. And I encourage everyone, whether you think you have this or not, we all almost no doubt have tight hip flexors. And it's super easy to, whether you're watching TV or playing video games or even reading, I'll take that position I was kind of talking about where I put my foot up on the couch, put a pad under my knee, and just, read a page while I'm in one position and then switch legs and read a page. And the entire time I'm squeezing my glutes. So
you're actually laying down. You're laying down.
Like I'm sitting up. I'm on like a one-kneed position.
Okay.
So if my couch is right there, I'll put my leg up on the couch. So where the front of my foot is up on the couch. Okay. My knee is flat on the ground. And then I've got one foot flat, like I'm in a one-kneed position, holding myself up.
So you're not actually sitting on the couch?
Nope, not sitting on the couch. Couch is just there for my foot.
I know what you're talking about now. You're putting the front of your foot on the sofa, and then the other foot is like almost in a lunge position. It's almost it's like a lunge, right?
Yep. Okay. There you go. That's much clearer than
Okay.
So if you're stretching that right hip flexor, for example, your right foot would be on the sofa. Your left foot is in that lunged position. And I'll just sit there and read like that. And like I said, switch sides every page, every 2 pages, and the entire time squeezing my butt, and you don't have to, go into this crescent moon position to get a hip flexor stretch.
Right.
And it's
Okay,
nuts how
cool.
quickly you feel it. I mean, I realize after like a long day of working and sitting here, if I go into that position after 5 or 10 minutes, my back feels better. I immediately feel more open and just
Yeah, it's
more
almost immediate,
relaxed.
right?
Oh
The
man,
relief you get from that.
even 5 minutes. And it's crazy to think about that. I mean, I can't think of, other than walking, there are not many times in my day where I go past neutral hip stance, like to where my hip goes into extension. And if I'm sitting all day, I mean, you're in 90 degrees of flexion most of the day. And this is
Yeah.
why these syndromes are so prominent.
Right. Right.
So addressing it with that reciprocal inhibition is the big thing. And then strengthening goes without saying. So of course, we're talking about those core muscles. I would definitely encourage you to listen to that podcast where we talked about training the core appropriately and intelligently. And then just breaking down specifically for the core, breaking down like you can work your fixed bottom while moving the top. So if we're thinking pelvis up, like your belly button up. So if we separate our body into 2 halves at the belly button, I want you to think about your core training, where in one instance you're moving the fixed top on the moving bottom, so you wouldn't be moving your torso in those instances, like your pelvis is moving. And then I want you to also think about core training where you're moving your top on your fixed bottom. Sorry, I hope that wasn't too convoluted. So you're thinking about those 2 halves of your body where the navel is, and
The
each
upper half and
instance,
lower half you're talking about?
yeah, the
Upper and
upper half
lower.
and the lower. And
So from
each
your navel up
instance,
to your head, from your navel down to your feet.
yes. And thinking about, alternating, always working one where your torso or your top half would be completely stationary. Hey, and you power go off. and
Get
then
the
your,
lightning going.
and then your bottom half is also fixed, and then moving your torso on top of that.
Gotcha.
So
Yeah.
that gives you that pelvis control, which a lot of us lack. And that's true real core strength right there, is where you're able to move your hips and your pelvic bones, your innominants, completely independently of other joints. And I see that a lot in personal training, where you try and isolate people's pelvis and they start swinging their legs and all sorts of things. So it's something we really lack, just in control and that connection to the core. And that's why we see these weak abdominals.
Okay, gotcha.
And with the glutes, doing things like bridges, bilateral or unilateral, so 1 leg or 2 leg hip thrust, abduction of your leg is super important. So bringing it out and away from your body, a little bit behind you, is great for the glute med. And then the glute hamstring raise machine and lunges with like a horizontal load, like a sprinter's lunge position, is going to target your glutes a little bit more than just that straight vertical lunge. And those are just some exercises. And that's just based off physics. So if you lean more forward, you could just imagine how much more stress is going on to your glutes, versus if you're standing straight upright, more of that stress is going to be going on your quads with your lunge position. So just thinking about like a sprinter lunge and just how can you target the glutes more.
Yeah.
And for strength, we know that anywhere between 6 and 15 reps is ideal for strength. So starting there to start building that strength, anywhere from 3 to 6 sets. Again, you play with these variables as you begin. And then I would also encourage you, once you've gotten some of that strength down, to really begin working on, some of those endurance repetition levels. So 20 or more, because we're using these things more or less all day. This is why we have such a prevalence of back pain.
Yeah, no doubt. So with the strength stuff, so we're talking about glute bridges, to strengthen the glutes, possibly body weight squats or loaded squats,
Absolutely.
lunges, body weight or loaded lunges.
Yep, absolutely. All those lower body exercises that you can think of are probably going to involve your glutes. What I wanted to do, like we're talking about the sprinter lunge, is just give you some real glute specific things. But absolutely everything you mentioned, squats, lunges, kettlebell swings, got to throw that in there.
Yeah.
all those sorts of things. I love the glute ham machine. That's the one where your legs are kind of fixated and you're
Yeah.
using your hamstrings and your glutes to kind of bring yourself up into extension. Obviously that's great. But just looking out for how can you, fit this into your daily life, because the reason these syndromes are taught to personal trainers to begin with, I learned them in undergrad, is because they're so prevalent. I mean, hip flexor tightness, it's almost a joke how you could put that in every single
And
physical
that's
therapy
just due
evaluation.
to our sitting lifestyle, right?
Exactly.
Primarily.
Primarily. And then
Okay.
that's where, I bring up why reading or watching TV, I'll sit in that lunge stretch position, because all day I'm sitting and at
Right.
90 degrees or whatnot. And like you mentioned, it can happen pretty quickly as far as feeling that relief. I mean, I'll
Right.
stretch for 5 or 10 minutes before I get into bed, and I feel a world of a difference better just in how I feel within my hip complex.
Yeah. So can you just go over the reciprocal inhibition? Because it sounds kind of like what I do with muscle energy stretching a lot of times. And
It probably is, yeah.
so a lot of times if I'm gonna stretch, so for example, the glutes, and I
Mm-hmm.
have somebody laying prone, and I lift their ankle up, kind of bringing their heel to their buttocks and seeing how tight they are. A lot of times I'll have them kick out towards my hand with them laying face down to where they're contracting where they're actually kind of contracting their quad, so
Yeah.
to speak.
Yeah.
Um,
You're
and
talking about
then
stretching the quads in this, or
yeah,
the
I'm
glutes?
talking about stretching the quads first, and then I stretch, and then
Mm-hmm.
I have them contract, and then I stretch. Is that similar to reciprocal inhibition? I mean, you're still focused on one muscle. You're not focused on the antagonistic. I
Yeah.
guess you are in a way if you have them contract and then relax.
Yeah, so the way I think of kind of that contract relax technique, which is how we learned it, that muscle energy technique that you're talking about, Kenny, is there's these things in our muscles called Golgi tendon organs, and they sense basically how much stretch or tension is placed on a muscle, and we can, in a muscle spindle. I'm getting
Mm-hmm.
my uh my physiology confused here. So a muscle spindle is actually what senses the amount of stretch in a muscle, and that's a protective mechanism. So if you're playing football and your leg gets stretched out from underneath you, you get a reciprocal contraction to kind of protect that overstretching. And
Yeah.
what you're doing, or what the theory is behind that contract relax technique, that muscle energy technique you're talking about, is you're kind of trying to desensitize that muscle spindle. So if you're stretching the quad and you have them contract it, you're sending a signal to the quad that, hey, everything's okay. We're not going too fast into this stretch, and you're slowly helping. Again, desensitize is, a weird word to play with here, but you're kind of desensitizing that muscle spindle to have that quick reaction and kind of hold on where you don't get as much of effective stretch.
And then contrast that with reciprocal inhibition then
And then, so with
again.
reciprocal inhibition, the muscle spindle that we were just talking about is specific to the muscle. Reciprocal inhibition is using the opposite sided muscle of the same bone to help relax the muscle. So if you're using the activation of the glutes, you're
Yep.
relaxing the hip flexors. So reciprocal
Right.
inhibition is contracting one side to relax the other side.
Okay.
And
So the
that's why.
antagonistic muscle.
Yep. And now you can use both those techniques, absolutely. And even when I'm when I'm doing that, when I'm reading a book, doing that same stretch that I was just talking about, I'll somewhat oscillate and kind of contract, like kick my foot into, so I contract my quad, my hip flexor, kick my foot into the sofa to kind of let those muscle spindles know, all right, we're not stretching too far. Like, this isn't an emergency where you guys need to contract and hold on, that sort of thing. So the
Okay.
difference is muscle spindle would more so specifically, like if we're stretching the quad, like in your example, we're addressing the quad. And
Yep.
in that example that you're talking about where the person's laying prone, you're stretching the quad, you would have them like contract the hamstring to get a further stretch of the quad. And then if you did that, you probably
I
wouldn't
see.
have to use as much force to fully stretch that quad.
Oh, I see. So it's okay. Yeah. So you can do them together.
100%. And
Yeah.
that's going to make it as effective as possible.
Okay, got it. Yeah, I was always confused about the difference between those two. All right, that's great. You
So
know,
go ahead, please.
just to so I think we talked about this on podcasts before, um, about my specific example. I mean, for me, I had back pain through my 20s and 30s. I mean, sometimes awful back pain, and I know we talked about that most people throughout their lifetime are going to have some form of back pain, but mine was pretty bad, where I went from chiropractors to I think I even saw an MD. I think I had imaging done and stuff like that.
Damn, Keoni.
One person, never a physical therapist, unfortunately, but it's very interesting, the thing that really seemed to get me on the right path, and that was stretching. But the main thing was strengthening my lower body, like doing these lower body exercises. We get in the weight room, and it was all like, who could bench the most,
Right.
who could do the most pull-ups, and legs were kind of forgotten, and it really needs to be the opposite. And as soon as I started focusing on that, I haven't had issues since. Get it every now and then from a long day of sitting, and that's just, you're kind of hitting on what we need to do.
Yeah, and that may be from a few things. I had the exact same thing happen to me when I was studying for the board exam and I was quarantined. My low back started to hurt a lot, and I think it's a little bit of that hip flexor tightness, and it's as well as when we're in this sitting posture, we almost have the opposite of that anterior pelvic tilt, where we have a posterior pelvic tilt because we just kind of sit down and slump.
Right.
And then there's this concept of creep for your tissues, whereas they're slowly elongated, they continue to go under that stress and elongate more. And if you can imagine that happening to your intervertebral disc and not having a great outcome from that.
Right. Didn't we do a podcast on sitting too?
We did. So
at some point, that's a good one to go back and look. I mean, the all the bad things, negative things sitting does to you.
Yes, and that's where we talked about upper cross syndrome. So just to give you guys, I looked those up. That's episode 14 is the combating sitting episode.
Yeah.
And I'm floating through our list here just to try and give you guys when we did the healthy. I know we've done a few healthy back ones, certainly with some other physical therapists. We did fighting back pain with spinal stabilization. That's episode 44. That is a great episode talking about training your core and some of those thoracolumbar muscles that I mentioned, like the multifidus. We really break that down in detail there. And I know, just trying to just give you guys the numbers. And we did episode 68 was intelligent abdominal training. So episode 68, as well as episode 44, would be some prime episodes to pair well with this one.
Great. Okay.
Anything else, Keoni? I kind of ran through it real fast there, but the takeaways are knowing that it's a pattern of weakness and tightness. It's super common. You can kind of see it in that anterior pelvic tilt. It's super easy to address, especially with just some intelligent activity every day. Like I mentioned, 5 to 10 minutes of sitting in that stretched position for your hip flexors will do wonders over the course of a month.
Yeah, maybe at some point we can have a link attached that gives us visuals or something for some of the stuff. But yeah, I think I got it. And then just the other thing is what's up and coming as far as podcasts. I some of the things that I want to talk about is right now it's real big, the wearing masks or not wearing masks. That's a controversy, unfortunately. And then
you trying to infringe on my freedoms here, Keoni?
Yeah. Yeah, that's right. I am. And then also some really fascinating research on sleep. So I'd like to get another sleep podcast in. I am a big proponent of getting as much sleep as you can these days. I mean, talk about all the sitting we do in our waking hours. Well, a lot of that I feel like as far as recovery and helping with pain is we're certainly not getting enough sleep either. And the research on it is fascinating. So I want to do something like that. So those are up and coming, as well as some other things. But if you guys have any other ideas, text us, email us, or whatever.
Yeah, absolutely. I'll tell you what, if 10 people fill out our salad form, I will create the PDF for the next month or two for the hip flexor stretching and all that kind of stuff. So that
Cool.
will go well. So hopefully, if you guys enjoyed this episode, please click the link in the bio, kind of fill out some of that information, get your free salad PDF, get the details on how to make that, how to prepare it. Again, it's a salad that keeps for over a week. I must have ate it 5 or 6 times over the course of the summer, Keoni.
There you
Absolutely
go.
love it. It'll keep you shitting too. That's perfect.
Clear out that colon, give you plenty of phytonutrients, make you healthy, get your fiber. Yeah.
Awesome, everybody. Well, thank you for listening. We'll talk with you next week.
Take care.